Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Welcome, everybody. In today's episode, I'm very fortunate to be joined by one of the wonderful functional medicine physicians who I came to meet through some of my journeys in integrative and holistic medicine, and it's Dr. Daniel Kessler. So Dr. Kessler, welcome to the show. And maybe we'll start by you telling us a little bit about yourself, because you have an interesting route of how you came to practice the medicine that you practice.
Yeah. Hi, Regina. Thank you so much. And hi to all your listeners. Yeah. So I was born in Germany. My father was a doctor, and my mother was a assistant, initially did some nursing, and my parents led a multidisciplinary team of over 25 nurses in northern Germany for more than 40 years. And they were known as medical detectives, where people came from all over the world to enjoy some of the modalities that they did in addition to very good internal medicine. So my dad was an internist, graduated at the top of his class. And then, so that was the seed where I was witnessing the effects that a integrative approach has, because integration means using both traditional and, of course, functional, holistic, those types of terms. But it really means getting to the root cause and listening to the patient. And then after my school was done in Germany, I went to the US in 95, went to Emory University, did my undergrad in chemistry, in biochemistry, also in organic chemistry, and then didn't go immediately to medical school, but worked at the Centers for Disease Control and Prevention at the National Center for Environmental Health. And my job was to analyze people's blood and plasma for environmental toxins. And unfortunately, we all have them, which was a very disturbing factor. So, and then studies were done.
Mm-hmm. So you actually it's interesting because I also come from Europe. I come from Eastern Europe, as you know, and growing up, we didn't call it, integrative, holistic or other medicine. It was just part of life, right? And so I remember my first ever aha moment when New England Journal of Medicine published a photograph of a patient who had cupping for resolution of pneumonia. And I said, why is this in New England Journal of Medicine? This was sort of like our daily routine, right? I come historically from Ukraine. So you you bring that attitude, I guess, European attitude, where not only was it sort of more permissive to practice this way, it was actually mainstream for majority of patients, right? Would you say that it's fair to say that, in Europe, especially Germany, Switzerland, there is significantly greater adoption of integrative mindset?
Yes, I believe so, because I used to grow up there, and I still to this day have very strong ties to both Germany and Switzerland. In fact, so after I came to the US, after the CDC, I eventually ended up at the Mayo Clinic, which is one of the world-renowned clinics. And I did my residency there in family medicine because I really wanted to learn this, not just how to take care of patients as a team, which Mayo is also known for, but Mayo also is known for to figure out the unknown when other places don't have that. But what I really enjoyed and what I learned is that people oftentimes still don't feel well, despite the best efforts. So that's when we have to look, why is our body burdened? Which then led me to environmental medicine. So I did additional training in Switzerland, became certified in what you mentioned earlier, European biological medicine.
So what is it? Tell us. So tell us, I have so many questions. So tell us first, what is European biological medicine? What does it do perhaps differently from the United States, and what it aims to accomplish? And do we have any data, maybe any proof, any outcome studies on its effectiveness? And also, what did you learn in your environmental pursuits, so to speak? Here, you worked for CDC, I guess, or Environmental Agency, Atlanta, Georgia. What did you learn in the United States?
So basically, ultimately, we want to identify the burden. So if you do testing, which the CDC did, very sophisticatedly, and I'm not going to bore your listeners with details, but we literally look at the plasma, we highlight the individual toxins that are present, and then we can prove it with something called mass spectrometry, so really quick. So we can know what is actually in the body. The problem is there are not very good ways to get rid of it. That's the big question. Well, we know we have it. What do we do about it? And what happens, the one term that your listeners have to understand, I know we talk about cardiometabolic risk factors, but toxins are metabolic disruptors. That's the term. They disrupt the function. So if we think about biologic medicine, then my mentors, they always said, it's very logical. We have systems. Our body has systems, cardiovascular system, endocrine system, other systems that become dysregulated because of the toxic burden. European biological medicine looks at things differently. We have ways to find out in what state a person is based on their exposure and how long they've had it. So if, for example, a toxin is in your system, let's say you get food poisoning, the first step that happens is you get diarrhea. Your body wants to eliminate it. What's the first thing we do? Some patients, they take Imodium. They say, oh, I got to stop the diarrhea, which is the worst thing you could do.
Sure.
So now if this toxin over time becomes deposited, then the tissue becomes inflamed and we can measure inflammation markers. So ultimately, European biological medicine has ways to drain the immune system and support the immune system at the same time. And then they have ways to filter the blood, prove to the patient the toxins have been removed. That's really how that would work.
So the patients so first of all, is the European biological medicine, how widely is it practiced and in what countries? And could you perhaps describe what is a patient experience like if they do decide to explore European biological medicine?
So Germany and Switzerland primarily. And there are 3 steps with every patient. The first thing is always an intake. We listen. Hey, Regina, what's going on with your symptoms? What have you been experiencing, right? The second step would be testing. So where we do traditional testing that every doctor knows, complete blood count, kidney, liver function, thyroid, cholesterol, vitamin, etc. But in addition to that, you do testing that is not widely available, where you can do, environmental burden testing. There's now companies that offer plastic testing, mold testing, infection testing. But the overall idea is to keep it simple. We want to prove what is this patient's burden, and can the symptoms they're experiencing, can they be explained by that burden? Yeah. Once the patient knows, there's always relief. Sometimes so much they cry because, oh my gosh, you're the first person. But then it takes time. It's not an overnight solution, because oftentimes these toxins have been in the system for decades.
Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. The discussion often gets heated and confusing. There are those who push for low fat, low cholesterol. And then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is owner20, and I'll see you in the office hours. So my understanding is, because this is where we kind of go into a little bit of uncharted waters, right? So you mentioned that testing is available, and actually some of it is available stateside. I did it first on myself, which is almost always my strategy. And then I started including it in our protocols, because you and I both know, and hopefully our listeners will learn very soon, is that there is a very strong relationship between cardiometabolic risk factors and actually environmental toxicity. Not just the particulate air pollution, but specific type of things, for example, microplastics, nanoplastics. And in my prior episode, I spoke with a colleague of mine who is a pulmonologist, and she's very active in the lung cancer field. And they also obviously monitor for a lot of toxic exposures. But what would you say are the top 3 toxic exposures, maybe even though obviously patients are all different, and you mentioned, being a medical detective requires you to figure out what's affecting this particular person, but what would be a top 3 toxic exposures that, based on the European biological medicine, you could say this is what we see most commonly, and what do you see as a chronic illness or symptom complex that is associated with these exposures? And I want to take, a little sort of aside here, because to make sure that our listeners understand is that association is not causation, right? So we know this, and, these are, none of the toxicology experiments were randomized. Nobody took a group of people and put them in a specific place and exposed them to a toxin. These are all observational studies, but observational studies are also very important because they give us data. And when that data starts to fall in the same way, we know that the signal is likely real. So the top 3 toxic exposures, and what are they usually related with?
Yes. So ultimately, when you look at the CDC, they have a registry of toxins that they publish on a regular basis. And everybody can go there and see that toxins are divided into organic toxins and inorganic toxins, for example. So here we talk about heavy metals, for example. We talk about pesticides, the whole agricultural issue worldwide. And then, of course, fallout when we think about weather, aluminum, those types of things. But the bottom line is there are scientific studies and the registry where people see these are the top. And for the most part, you always have the top players like heavy metals, for example. But this is not the first thing that I look at when I deal with patients. Okay. The biggest thing I look at is sugar.
Okay.
Right. So when I work with patients, I always say, why are you burdened? What are you burdened by? And I divide toxins also into thoughts. So some people have toxic thoughts. Mm-hmm. And I want to know, how are you burdened mentally? So I talk about mental burden, stress, and I talk about chemical burden and physical burden. And when we don't feel well, when we feel uncomfortable, then oftentimes we turn to comfort foods.
Right.
Sugar.
Sugar.
Right? And
carbs in general, right? And this sort of people, I think in my patients, what I see very often is that they have this drive to carb load, right? There's sort of, and people say, well, they're addicted to carbs, but they don't want to be addicted to carbs. They're not choosing to do this. They just have this, very insatiable drive to consume extra carbohydrates, and as if their brain is not registering that they're actually full and the sugar is already in.
Yeah, exactly. And there are, again, there are multiple scientific studies that showed how addicting sugar is, for example. But when we do traditional blood tests, we can measure, for example, if somebody is already insulin resistant, do they have imbalance in blood sugar? We can prove to them. Some doctors may say the level is not bad, but it's not optimal.
Right.
But then when we make simple changes, now, the first thing I always do in functional medicine, we learn about elimination diet, avoidance of toxins. So the very first thing I do with questionnaires or interviews like this, for example, I would say, think about your environment, mentally, how are you doing, stress-wise, food-wise, what are you doing? Non-judgmental. I always say, my mom always taught me this. She said, don't give me excuses, give me the good stuff, the real stuff,
Right.
Sometimes I even tell patients, give me no BS, give me the real stuff, right?
Don't lie on your intake form. That's not good.
Yeah. And then sometimes I share with people my own story, how I was sick, and I didn't always eat well. So we share this vulnerability. It is so important that you do that because that gets to the crux of the matter to identify what the toxins are. And oftentimes, if we clear up the diet, and I'll give your patients some guidance on that, your listeners, something they can do at home. Oftentimes, the fiber from the diet is so high that automatically a lot of toxins
pulls the toxins out.
Yeah.
Yes.
And by drinking the right kind of water, you flush out your system. If the patient is still not feeling well, or God forbid they have significant burden or cancer or worsening heart disease, you can always do fancy testing where we can measure heavy metals, pesticides, all those things. But in a nutshell, toxic thoughts and stress, sugar, and then each person's individual environment needs to be assessed to see what the burden is.
This is so true, because I have to tell you that, first of all, I'm really loving the fact that you're putting toxic thoughts and toxic relationships at the top of the list. And I learned personally when you and I are both trained in functional medicine. It sounds like functional medicine has quite significant overlap, at least conceptually, with European biological medicine. But I'm a big fan of some of my functional medicine mentors, and one of them was Dr. Bob Roundtree. And I still remember when he delivered one of his presentations in one of our training modules, he was talking about toxicant-induced low tolerance syndrome, or TILT. And yes. I thought to myself, well, that sort of seems sort of out there. And one day I was riding with a friend of mine. She was driving. She was in a new vehicle, actually a Mercedes, a German vehicle. And we were driving to New York City for, I think we had a professional function of some sorts. And she had some sort of a thing in this vehicle, whether it was an air freshener, there was something in it, perhaps, whatever the new vehicles have, or maybe she was, sort of just putting some perfume into the air. And by the time we finished this ride, which was about 45 minutes to an hour, I became nearly violently sick. And I recognized that I was tilting, right? That was that tilt, because prior to that, when my patients would say, oh, I'm sensitive to smells, I kind of thought to myself, that sounds sort of, yes, very noxious smells, of course. But they said I'm sensitive to perfumes and sensitive to certain smells in certain houses. And I sort of would always take it with a little bit of a disbelief. But since that episode, I said, nope, I know exactly how they feel. And it's a very, very uncomfortable feeling. And I noticed that it would worsen at the times when I had stress, right? Either emotional or physical stress would actually worsen and bring on some of those episodes.
That makes sense. Yeah. tilt syndrome, the first time I came across that was there's a wonderful book. It's called Detoxify for Life, written by Dr. John Klein. He's a medical doctor out of Canada. He was also one of my many mentors, wonderful person. Make a long story short, he was driving in a cab, and then his passengers, co-passenger, as they were talking, they said, "Hey, have you heard of tilt syndrome?" And he actually called it toxin-induced loss of tolerance.
Mm-hmm.
And if we think about, you mentioned toxic relationships, then ask yourself, how long can you really handle to be around something? That something could be a person. It could be a moldy place. Like I unfortunately grew up in an old house and I had mold toxicity when I was younger.
Mm-hmm. Mm-hmm.
Or how many people have now the plastic exposure, right?
Right.
And they just don't know. And I always tell people when we don't feel well, feeling is always from our nervous system. That's how we feel, you know? And when we think about the cardiovascular aspect,
Mm-hmm.
how many people have autonomic nervous system issues that are dysregulated because of things we didn't think of? For example, toxins. Happens all the time. So that is why, really, really quick, I have one patient who had uncontrolled high blood pressure. He's 68 years old, couldn't walk, could not walk, very inflamed, had knee problems so bad he was told he needs knee replacement.
Mm-hmm.
And I tested him for toxins, mold came up, treated it, did some dietary changes. He hated vegetables, now he loves them. And within 6 months, this is a true story, he gave me a video testimonial. He is now playing tennis 4 times a week, zero pain, blood pressure 120/80, off of all blood pressure medicines, all by removing the environmental burden naturally, right?
Amazing. I mean, mold is very tricky because I know you're definitely one of the practitioners who specializes in a lot of these chronic infectious syndromes, whether it's mold or Lyme disease. But there are, as you mentioned, there are environmental triggers that are so widespread. So, and I was intrigued by the article that you and I both discussed because we've been discussing it essentially ever since its publication in March. And that's the one on nanoplastics and microplastics, right? So let's talk about it a little bit. It's publicly available. People don't have to have a subscription. It will be in the show notes if our listeners wish to read this. So it's nothing too unusual. It appeared in the New England Journal of Medicine, and it was about the exposures that some patients had to microplastics and nanoplastics. And it was specifically about those patients who actually had surgery, and they had very specific type of surgery. They had carotid endarterectomy, right? So they were asymptomatic. They had significant blockages in the carotid arteries. So that's completely routine, standard medical care. And because of these blockages, those blockages were excised by about 300 or so patients. And Daniel, tell us what they found, because I know you know that study, like a back of your hand.
Yeah, ultimately, there was proof that particles were within the lining of the arteries. And we've known this for a very long time. But as you know, you and I know, we're very well-trained doctors. It always takes time for this to really catch on and be proven. Everybody always waits for that study. But so the good thing is we have that study. But what you always have to remember, that when we practice medicine, we work individually with patients, because most of our patients have never been in any study. But the mere fact, that there's no proof, and by the way, since the study has been published, this is now exploding, this field. Ultimately, plastics causes inflammation in the lining of the arteries. And why that is so important is that most people always focus on cholesterol. when really, I know you know this, but inflammation, oxidative stress, and damage to the lining is really the culprit. Oftentimes, cholesterol is then seen as a response to the initial injury. Some people can have, genetic reasons, of course, 100%. But so what do we really do to release and to decrease, the inflammation? That is really where we have to focus with our patients.
Hi, everyone. It's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Heart Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticheartcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping. Cholesterol, and I always tell my patients, and I'm sure you probably follow the same logic, is that I always explain to them that cholesterol is the first responder, right? So this is a first responder. This is sort of like a fireman who shows up with, a fire hose to a fire, and they're trying to extinguish the fire. They're pouring, whatever they have, foam and water into it. And yes, there will be some damage because of the rescue efforts. And sometimes that damage actually doesn't go away. And this is sort of when cholesterol stops being the first responder and starts the perpetuator of damage. But the root cause is still an imbalance of some sorts, and whether usually it's inflammatory response. And what was interesting in this study is that, as it is in almost all of these studies, is that it's not just inflammation in the isolated fashion, it's our immune system which actually pushes us to respond in the inflammatory way, which is what we need to do to survive as, living, breathing human beings. But that's really one of the things here. And in this particular study, and I have, the article open in my notes so that I can look at the numbers directly. I didn't really memorize them. In those patients where they found deposits of microplastics and nanoplastics in the carotid plaques, they found a couple of things. Those patients were younger. They were primarily men. And interestingly, that in this study, majority of patients were actually males. They had more high blood pressure, more diabetes, more cardiovascular disease, but their total cholesterol, the mean cholesterol in both groups, was at about 150, and the LDL cholesterol was about 74 to 77. So they really didn't have numbers that we would say, oh my goodness, these are terrible numbers. They were on statin medications, so about 95% of them were on statin medications. But their triglycerides, and that goes back to your cardiometabolic, and the New England Journal of Medicine article didn't mention anything about triglycerides in these patients. Their triglycerides on average ran anywhere from 165 to 190, right? And so we don't have any, cardiometabolic lens in this toxicity or microplastic studies, even though the laboratory data is suggestive that these patients, their BMI was in the overweight group. These patients most likely had a cardiometabolic syndrome. Would you agree with that? And what do you see specifically, in terms of patients presenting with cardiometabolic syndromes when they are suffering from the toxic exposures?
Yeah, and this is all true, of course. What I always tell patients is, I learned this from my dad. My dad always quoted Thoreau, and Thoreau said, simplify, simplify, simplify.
Simplify, yeah.
Ultimately, what the patient wants is to feel better. And the patient wants to know, why am I not feeling the way I deserve to feel? And what can we do about it? And when we deal with cardiometabolic risk factors, then high blood pressure is really the most important, I believe, because it is silent, just like cholesterol sometimes is silent. But when I look and explain to people the effect of the toxins on the arterial lining, I always simplify it. I say, in physics, it is pressure defined as force divided by area. So either the forces we are exposed to are too high in our life, and they can be anything, relationship forces, food forces, or something pushing us down. And if we think about people that experience heart attacks, they always, not always, but they present sometimes with, I feel this pressure, so something is burdening them. Now, if somebody has very small area, so most of the arteries that oftentimes we see the arteries here are bigger, of course, the carotids, but oftentimes the arteries that get most affected are the small arteries. We call this end organ damage in medicine. Those are the capillaries. Or even in our brain, we have very small arteries, kidneys. And when we do specific testing, we can sometimes see decades before that this damage is already there. So that is why, from a preventative standpoint, it is so important to tell people, if you have blood pressure, what is normal, what is abnormal. First thing is always lifestyle. But what are the forces in your life that are affecting you? We start simple: food, diet, sleep, stress, etc. And then if they are still uncontrolled, then we say, well, could it be environmental toxins?
Environmental exposures. Yeah, exactly. But, go ahead.
One last thing. What is super important is the relationship of the mouth to the lymphatic system. One of my family members was a dentist, and we all know that our lymphatic system is what keeps us healthy. And if people have metals in their mouth, or infections, or periodontitis, gingivitis, all these things, these are bacterial burdens, toxic burdens that have to be removed. And it drains, and the lymphatic system, for your listeners, is very close also to the arteries, and there's this interchange. So naturally, the question arises, since we're eating, how much plastics do we consume that are so small we don't know, that then get deposited also here?
Right.
And from water sources. That's
from plastic. Yes, from plastic containers. And it's interesting because I dug into the article a little bit, and they do have kind of the sizing information there, because according to World Health Organization, not all of these plastics have been created equal, right? So there are specific diameter plastics. Usually it's 10 micrometers in diameter, or just larger than 150 micrometers, will not get absorbed into the blood and will not penetrate the blood vessels. But the smaller they are, and usually that's in nanometers, right? So this is 9 nanometers, I think is 9,000 times smaller, almost 9 million times smaller, actually, than a millimeter, that is actually gets absorbed. And what was interesting in the research that this group did is that those patients who demonstrated deposits in their carotid plaques actually did much worse. So their rate of non-fatal stroke or non-fatal MI, or actually dying for any reason, was almost 5 times, 4.5 to be exact, of those patients who didn't have any of those plastic deposits. So the nanoplastics and the microplastics are in the food containers. They're in cosmetic containers. So I'm a little bit a little bit unhappy that the study actually didn't make an effort to include more women because we use a lot of cosmetic containers. So I see a lot of patients asking certain things, and I'm wondering your opinion about it. There was a recent article just in the late press. Would a water filtration system help the nano and microplastic exposures?
Yeah. So I don't endorse any particular companies or products, of course. I think what I'd like to do here is give your listeners some tips. And I learned these tips from Dr. John Klein, one of my mentors. Again, he wrote a book called Detoxify for Life. Really quick, his wife was very sick and nobody could help her. And he became a toxicologist for that reason. And then detoxed her and thousands of other patients. So in general, what we want to achieve as an end goal is we want to decrease the burden of our immune system. And we want to think about the environment that we live in. So the air quality. So air quality is important. Water quality is important. And when it comes to water quality, then people can go to the Environmental Working Group website, and people can type in their zip code, and you can see with your own eyes, based on your zip code, how bad the water quality is. And bottom line, it's bad. There's no pure water.
Bad all over the United States, or bad in certain areas more than others?
Some areas more than others, right? So, for example, Flint, Michigan, everybody knows that story.
Right. Sure.
Now, the thing is always where people have questions, what water should I drink? How do I know? Ultimately, we want to avoid plastics. So glass containers, glass bottles. So this is not wine, this is mineral water, you know? So glass bottles, right? And then when it comes to filters, then what's important for you to know, I mean, you know this, but some of the listeners may not know, that when scientists looked at the water quality, oftentimes we find other things in the water besides plastics, including medicines, you know, antidepressants, all kinds of things. And they were able to prove that by looking at, you know, insects and frogs, and they found that most of them were female. So you have this hormonal disruption in the world. And since we are what we eat and we are what we digest and absorb, that's why if you buy a filter, talk to the company, have the company show you proof specifically for plastics. And there are some that will do that.
Sure.
But personally at home, we don't use any tap water whatsoever. We just don't. Yeah.
Well, we have a filter, but it's certain specific locations. I think the filter most likely needs to go to the house water main. But yes, I think filtration is definitely easy enough to get, you know, to get information on. So that's a great tip, you know, which filters.
And also the shower. Chlorine exposure. We do have our water in Florida here is very hard. So we do, you know, make sure. And then we have special shower filters. It's amazing how many people over the years have been exposed to chemicals from the showers. And then their autonomic nervous system becomes imbalanced. Simple. Yeah.
Simple stuff. Yeah. And that's, you know, it's so important to understand that part is that, and, you know, I'm going to talk about the stuff that you and I know sort of at the crux of the functional medicine, right? So when our systems are challenged in terms of exposures, because nobody is going to live in a bubble. We all getting exposures every single day, whether it's exposures from people or bad news or just microbes or viruses or toxins in the environment. Our biological system is very unique and very smart because we respond to defend ourselves. And there is a concept of hormesis. And I always try to explain it to my patients without sounding too scientific. And I tell them it's sort of like a string attached, you know, and let's say it's like a little rubber band. If you push on it with your finger, it will bounce back. But if you stretch it too much, it will snap. And this is where our load of exposures is just overwhelms our hormetic response. And our system no longer responds favorably. It basically disintegrates. And that's really the crux of the chronic diseases.
Yeah. One good thing I also do, this is maybe also helpful for your listeners, is what I use, and this is something my dad taught me also, is the concept of a balloon. If you take a balloon and you blow it up with air, then it adapts to the stress. Remember, force divided by area. So you blow the air into the balloon and the balloon adapts, just like our body adapts.
Right.
But then sometimes we blow it up so much where people around us will say, "You're crazy. Are you crazy?" And sometimes we play these games. How long can we do this until it pops? And then we laugh like children, right?
Sure.
But if one time I gave a presentation, had a balloon on stage, and I said, okay, I'm going to blow this up and I'm going to press it with my hands, and the balloon adapted. This is important because our blood pressures adapt, to the pressure. And then I took a little needle and I touched it just a little bit on the balloon, and I said, look, nothing happens. But with the right amount of pressure, a little thing, boom.
And it pops.
So my dad always said, we were always taught to not sweat the small things until we realize everything is small in our life. So if we look at all the small things in all areas of our life over time that have accumulated, then if we then look at blood pressure, for example, and we say, your blood pressure used to be 120/80, but now it's 130, 140, then we can think about cumulatively the burden. And we have to look at all the burden, right? That's always...
Exactly. And, when it comes to blood pressure, actually, I think one of my prior episodes was on rapid response, because I always get asked by patients, well, how much weight do I need to lose to get my blood pressure to normalize? And why isn't my blood pressure normal? I lost weight, I lost fat. And, you and I, as you know, I also run a cardiometabolic program, which is very specific because we want for patients to lose their internal visceral fat while preserving or building muscle, and we strive to give them as optimal metabolic health as we can. And so patients are very often, or we as adults, they tend to kind of silo things, and they feel like, well, I'm exercising, I'm having a good diet, I lost a certain amount of weight, why isn't my blood pressure normal? And this is exactly the reason, is that it's a situation where, and I read this phrase recently. So somebody in the government, when it comes, let's say, to government response to overseas emergencies or conflicts, right? They say there are known knowns, known unknowns, and unknown unknowns. So losing weight for blood pressure is a known known. But then there are those known unknowns, things that we know may influence it: cardiometabolic health, toxic exposures, occult infections that we don't know about because we have to test about it. And those known unknowns are really critical, right? And of course, what we don't know, and we may not be able to find. But I think it's really important for patients to understand that there is a stepwise process. And as always is in personalized medicine, we fit what we know to a person, trying to uncover those known unknowns to give them the actionable steps that they can take to improve their health. And, I'm very heartened because one of my patients was managed to reverse his fatty liver disease, which is fantastic, because this patient wasn't particularly obese and was already doing everything that they could on their own. And just to be able to give patients a very clear, structured plan is key, because you and I practice this type of medicine. We don't always have all the answers. Actually, very, very often we do exactly what you said. We're being medical detectives, right?
Yeah, absolutely. Yeah. And this is actually a nice transition into the liver. The liver is our metabolic factory. And when it comes to detox, ultimately, remember, it's about decreasing the burden. And our liver has to deal with everything that comes into our system both organically and inorganically.
Mm-hmm.
And our liver, for those who don't know, is on the right side, right under your rib cage, gallbladder, liver area. And what's interesting is, from a cholesterol standpoint, that cholesterol is a first responder. And I have seen this in thousands of patients when they were exposed to an infection or they were exposed to stress or toxins, then ultimately the adaptation means they need to adapt their hormones. But all the hormones come from, of course, the cholesterol. So the liver has to make more of it. And so from a food perspective, if you now think about, if you feel uncomfortable and you have whatever comfort food you like, it could be alcohol, it could be sodas, it could be ice cream, too much sugar, whatever, then the burden falls on the liver. And it is, and then you and I know this, the body then takes the sugar and creates cholesterol from the sugar. But if there's excess sugar, then excess cholesterol has to be produced that then needs to be stored, and hence it becomes a storage issue. So if we now go back to European biological medicine as a final transition, then we think about, you were exposed to a toxin. The first step in European biological medicine is elimination. So we have to make changes so we can eliminate toxins from the environment to avoid long-term deposition. But if someone has deposition, like fatty liver in this case, then we have to be able to show the patient, how can you burn fat? Hence, low carb, low sugar. But what Dr. Klein did, he went one step further. He said, there are 7 colors of the rainbow: red, orange, yellow, green, blue, indigo, violet. So if we give ourselves all colors, except for white, every day, then the liver eventually is able to handle the burden better. You get the fiber, your cholesterol goes down, blood pressure, etc. And then you can eliminate. That's the most simplest thing that everybody can do at home.
That is so true. And, there are still, as you mentioned, there are so many heated discussions, right, in the world of nutrition. Should it be a vegan diet? Should it be a vegetarian diet, Mediterranean for cardiometabolic? What about intermittent fasting? Or is it 12 hours, 16 hours, 18 hours? I'm a big fan of something called fasting mimicking diet because I use it a lot. And I think we need a separate discussion just on that. But the simplest things in many ways are the hardest, because this is what everybody knows they should be doing, and yet they're looking for that magic bullet. And eating the colors of the rainbow, as you're describing, is a very well-known nutritional concept, increasing the amount of polyphenols, increasing the amount of fiber. And this is essentially the base or the foundation of any detox. So, so if we were to close, right, what are your top 3 just bullets only advice to patients? And I'll do my top 3, or I'll see if ours are divergent. So number 1, what do you want every person to do in order to improve and optimize their health?
Yeah. So when people listen to podcasts, then it's always the last 5 minutes they remember the most. TIL syndrome. You need to understand toxin-induced loss of tolerance. So if you draw a line from left to right, this is your life. You make a little pivot in the middle. You say, what do I have to remove that is toxic? And be unapologetic about it. I always tell people, this is the number 1, make a not to-do list. Not a to-do list, but a not to-do list. What are you not going to do anymore from today? And decrease the burden. It could be relationship, food, whatever, but stick to it. Then induced loss of tolerance means if you're staying in the same environment and expect different outcomes, that's the definition of insanity.
Insanity, yes.
Right.
Thank you, Albert Einstein. We said that.
Yep. So be the change that you want to see, right? Another famous guy, Gandhi, said that, right?
Yeah.
So, but that's the thing. Understand TIL syndrome. And then the second thing is what my mother said, cut the BS. Your body knows what the toxins are. In European biological medicine, they teach us, let the patient tell you, just like Dr. Osler said, the patient will tell you what is going on.
Correct.
Listen to yourself. And then the third thing is doing is doing. Stop talk about it, do it.
No BS.
But be consistent, be 1% better every day. And if you do that, then you are 365% better by the end of the year.
That is so well said. And I do agree. I do like this sort of, what I tell my patients is that there is a list of non-negotiables. So this is sort of your not to-do list. The removal, reassess your environment. And this is really profound because I had a patient experience where by restructuring their environment, and I'll talk about this a little bit, in a different episode, we actually managed to avoid a defibrillator placement because this patient who was in heart failure with very low ejection fraction recovered into the normal range. So restructuring the environment was absolutely critical. And it's not what you think. It wasn't, fighting mold in his house. It was something very, very different. And the third point, I can't emphasize it enough, consistency and compliance. So no BS, because if you're doing changes just a little bit and you're not being honest with yourself and you're sort of not really following, you're not really going to get a result. One can always run off and get medication for blood pressure and try to get, good numbers, but that's medications for blood pressure reverse potential damage and prevent for the damage from happening, but none of them reverses the reasons why blood pressure gets elevated in the first place. So those are, great points. And Dr. Daniel, was a delight. Thank you for coming onto the show and introducing us to the concept of European biological medicine, as well as the whole approach to how to reduce the toxic loads in our patients to reduce their cardiometabolic risk. Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Heart Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Heart Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticheartcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.